we know microorganism can spread everywhere and from anyone to any another one. In hospital also it can spread from one person to another person. How to prevent this? Infection control. Myself Sukumar, I am the student of occupational therapy. In any healthcare sector, there is a possibility to spread microorganisms from patient to staff member, patient, staff member to staff member. So infection control is very important because in a healthcare facility, the sick people has in a confined room. So nurses are taking care of it. So if the person having the microorganism, having sick due to microorganism, that microorganism can be spread to the staff nurse and it can be transferred to the staff nurse between the staff nurse and another staff nurse can spread it to the another patient also. So in a healthcare sector, there may be a possibility to produce many contaminated wastes and body substances. So parts of the finger also become a waste. So these wastes having microorganisms, there is a heavy risk of spreading the microorganisms and spreading the infection to the healthy person. I want to introduce a new term called nosocomial infection. What is nosocomial? So if a person having some illness and admitted in a hospital, due in hospital period the person getting the new infection. So during admission the person have no infection, after admission the person may have chance to get new infection. This infection is called a nosocomial infection. It is an infection occurred in a hospital, not only hospital, in any healthcare facility. Okay, to control infection, what are the precautions are there? First, standard precaution. In standard precaution, some steps are there: hand washing, protective equipment, sterilization. In this decontamination and cleaning also included, and waste disposal. These four are the standard precautions. In additionally, microorganism may be having airborne. So airborne precaution, droplet precaution, and contact precautions are also used in the hospital to prevent the spread of infection and controlling the infection. Okay, first we are going to see about standard precaution. First is hand washing, cleaning the hands. So it is the basic hygiene should be maintained by every healthcare professionals. Hand washing has some professional steps. First, rinse in water and apply the soap and palm to palm, dot some interlocking of fingers and opposing palms and thumb rotation, finger rotation. In surgical precisions, they use wrist rotation and they wash at the level of elbow also. So this is the basic preventive measures for controlling the infection. Okay, I will upload a specific video for teaching the steps of the hand washing by shorts. Okay, next protective method is using the protective equipment. So it is called PPE, personal protective equipment. So we wear some equipment from head to toe to protect ourselves from the microorganism. We may notice in corona period the doctors are wear PPE. Okay, what are all the components in it? First, head cover. It is also known as cap. Then eyewear is also known as goggles. So goggles are weared. Then mask, gown. So gown is a wearing. So the doctor may wear. Then apron is weared above the gown, and knee cover. So the gown covers only above the level of the knee. So below the level of knee, they use the knee cover. Then for hands, they use gloves, and for foot, they may use shoe covers or the knee cover also protect the foot. Okay, goggles is a right eyewear. So it is also known as face shield. So in front of the face, they have the transparent sheet-like structure. Okay. Gown covers neck to knee, and in arm they cover toward until the wrist. Goggles are placed in the face, eyes, so it can be adjustable. Okay, these are all the protective equipments used by the person. So hand washing and protective equipment, they are the standard precautions. And sterilization. What is sterility and fertility? In fertility, there may be a presence of the organism. In sterility, the complete absence of organism. So complete killing of the all microorganisms is called sterilization. How the sterilization occurs in four main ways. First, autoclave. They use high pressurized steam to kill the microorganism, that is called autoclave. Dry heat in a oven, they kill the microorganism. And using chemical sterilants. So they use chemical sterilants and they kill the microorganism. Example, glutaraldehyde solution, formaldehyde solution. These are all the chemical sterilizers. Then radiation. So using radiation, some microorganism can be killed and sterilized. So these are the four main ways to sterilization. Decontamination, it's the just back to the sterilization. So in sterilization, all the microorganisms are completely killed. In decontamination, the contaminated items are removed so that minimal amount of microorganism can be restricted. In this, bacterial microorganisms are not destructed, so there may be possibility to spread the bacterial microorganisms. Example, ultraviolet light also the disinfectant, so it can be used after the discharge of the patient also. Then cleaning, so housekeeping department. So in hospital, housekeeping department plays a vital role because any infection can be spread in the uncleaned area. So cleaning is the hygienic activity. So in healthcare facility, there should be a very good cleaning. So each and everywhere that should be a cleaned. So all surfaces, all loft, all areas should be cleaned so that the microorganisms cannot be spread. Okay, in standard precaution, we saw about hand washing. Now we will discuss about the waste disposal. In hospital setting, we can notice 5 different color containers, plastic containers having dust. So this system is implemented to segregate the solid biomedical wastes. First, non-infected waste are kept in the black container. In this black container, psychotoxic drugs and chemical pharmaceutical materials drugs are all disposed. So these are all secured landfilling. After waste collection, these are all securely landfilling. So this is the non-infected waste in black. Then infected waste in 4 colors. First, red. In red container, soiled waste, example POP, casted, infected dressings, so that are collected in the red container. After collection of the wastes, it should be buried deeply in the land so that the infection is not affect any other people. So the persons bury deep and they dispose the wastes. Then anatomical wastes are kept in yellow container. Example, the placenta and any injured fingers, any injured body parts are all collected in the yellow container. Then blue container has infected plastics, example syringe, gloves or any other plastic infected materials are collected in the blue container, and it can be disinfected with a chlorine solution with 1% and it can be recycled. Red and blue, red and yellow containers contained waste should be deeply buried in the land, but in the blue container, plastics can be recycled. Then white container, sharp materials, needle, broken glass, the sharp breakable materials are all collected in the white container. Additional to that, airborne precautions, droplet precautions, and contact precautions. The microorganisms spread in the airborne, so that are all controlled by the airborne precaution, droplet precautions. The droplet infections can be prevented, and contact precaution. So by touching the skin and wound infections are spread in the contact infection. So it may be direct contact or indirect contact. So these precautions. So after contacting, there should be a hand wash, there should be a bathing. That like precautions should be maintained. So the safety precaution nurses should be maintained. The lab should be visit microbiology lab, visit every ward and every cleaning sectors. They should be maintained. Okay. Today we are discussed about infection control. In our next videos, we will discuss further topics. Thanks for watching. Be proud to watch our video. Tata.